Speaking about the vagus nerve, a lot of yoga is not just the physical postures, that's just one piece. If anyone knows yoga, there's 8 limbs to yoga. So one of the limbs is the physical practice. One of the other limbs is pranayama, which is breath control. That's all that means. And the breath can affect your nervous system pretty much more than anything. I always say, I can teach you a breath that's going to work better than a Xanax because it has less side effects. So going along in terms with the vagus nerve is that some of the breathing techniques also activate the vagus nerve. One of the breaths that we use in our practice that we teach is called the Ujjayi breath. And what that does is it's actually through the glottis, and it sounds like Darth Vader. So it's the whole breath sounds like this. So it's not, sometimes when you're learning the breath, people think, I'm like you're breathing in and out of your nose through the whisper muscles in the back of your throat. And a lot of people think but it's not through here, it's actually through here. And what happens is when you're practicing in the practice in our studio, we'll say, 3 times a week it changes your body, and you practice 5 times a week and it changes your life. And part of that is because when you're doing yoga, you're putting your body in positions that are, physically uncomfortable and demanding, and it's activating that stress response in your body. And then the breath is teaching your body how to handle stress. So we use that Ujjayi breath to calm the body down. So what'll happen is I'll be driving along, and then all of a sudden we get into almost a fender bender, and automatically I'll be like I get into that Ujjayi breath, and it's because I've been practicing for so long that my body knows. It's like my body, mind, spirit, knows this is the breath that's going to just calm her right down. So the other thing is making your breath twice as long. Making your exhale twice as long as your inhale is another great technique. It's a great technique to teach clients. I always say how to calm themselves down if they can't sleep at night. So it's just making the exhale twice as long as the inhale. So a lot of times I'll talk them through and say, let's take a breath in, and I'll count at 1, 2, and then out, 1, 2, 3, 4. And if you do that a couple times, and you sort of work it through with them and help them to understand that, most of the time, I've never had anyone not say it. They'll be like, wow, like my blood pressure, everything just feels like, I'm here, So those are, the breath is really important. We talk about mindfulness, and one of the limbs is meditation, and I'm a big proponent on mindfulness, and mindfulness for depression, mindfulness for anxiety. There's a lot of that now that's out there. There's mindfulness for eating disorders. But in terms of yoga, I feel like yoga and the system of yoga, the whole 8 limbs, not just the physical practice, really is a great way to get people in trauma, people that have trauma, people that don't have trauma, that have anxiety, that just have regular stress, day to day. It's great to be able to teach some of these breath techniques because they're things that you can do anywhere. And it's a tool to teach people that you have the ability to take care of yourself. So it's also very empowering in that you can heal yourself. You can take care of yourself. You have that ability. So I think that's also another piece of it. It's empowering to our clients as well.
Thank you.
You're welcome.